There was a landmark randomized trial called SPRINT, which was published in 2015, which randomized 9,000 participants all across the United States to a standard blood pressure treatment goal or a more intensive goal. That trial was designed, planned, and executed in part by the University of Utah. We were one of the 5 clinical coordinating networks. And that trial was a landmark trial because we used to treat blood pressure to the systolic blood pressure, the top number of less than 140. And this trial showed that by treating to 120 compared to 140, you had less heart attacks and strokes, a lower all-cause mortality rate, and most interestingly, a lower rate of the combined outcome of mild cognitive impairment. This new grant is taking that legacy one step forward and using the 40,000 blood samples from the trial to look at novel blood biomarkers of Alzheimer's disease pathology to understand if the effect of more intensive blood pressure is different among those with baseline Alzheimer's disease pathology or not. And it also will help us understand the degree to which intensive blood pressure affects biomarkers that are indicative of Alzheimer's pathology, vascular brain health, as well as neuroinflammation. One of the other really exciting things of this grant is it will help accelerate perhaps or usher in biomarker-based guidance for screening, perhaps monitoring and guiding treatment. This will be one of the first studies of this size with this biomarker, with this number of measures.